Welcome back, everyone, and thank you for joining us for a community conversation on the African American community at a crossroads. We've shared an opening presentation from Darrell Akon doing his rendition, operatically speaking, about leadership from the days of W.B. Du Bois and George Washington Carver to current day leadership in his excellent presentation. Our next panel was then talking about education and employment and what the status of that is in the African American community. This is our third panel of the day, and it's important to me because public health carries so many different determinants in terms of what contributes to a healthy family, a healthy community, and each of you represent a component of that in your own way. And so let's begin with introductions, and we'll start here with you, Dr. Davis. If you could just give your name and what you represent, and when you think about public health, what does that definition mean to you? And let's just share that with everyone first.
I'm Anissa Davis. I'm the City Health Officer for the City of Long Beach. I represent the Long Beach Department of Health and Human Services. And we really are the organization who is responsible for the public health for all of the residents of Long Beach. So public health really is having a safe and healthy place to work, live, and play. And that's what we represent.
Good afternoon. I am Carolyn Caldwell. I'm the president and CEO of St. Mary Medical Center here in Long Beach. And Derek, thank you for hosting us. And I'm so excited to be on this stage with these women today and with their various background and leaders, because I think it just shows to me what public health is really all about, is how we all work together for the betterment of our community, because none of us can do it alone. From the hospital standpoint, people often think about is sick care. People come to us when they're sick, but one thing we're really trying to focus on is well care. How do we partner with our community partners to reach people before they ever become sick?
Hello, my name is Jennifer Ponce. Thanks again for inviting us all here. And I am the Chief Health Education Officer at the Children's Clinic in Long Beach. And although we're called the Children's Clinic, we see adults. In fact, about a little under 50% of our patients are adults. And public health for me is a chance for everybody to have a healthy life, mentally, physically, socially, emotionally, and to work together and tap into the community's intrinsic wisdom. Thank you.
All right, and my name is Diane Brown, and thanks for having us. I am with the City of Long Beach's Department of Disaster Preparedness and Emergency Communications. I'm also I teach public health at Long Beach City College, and I worked for the Long Beach Health Department and LA County Public Health departments for many years. So although disaster preparedness and emergency communications may not seem like it is a public health issue, our goal is to help make communities more resilient, which is exactly what public health is all about. So I'll be able to provide that perspective as the panel continues.
Let's stay with you for a moment, Diane, because when you talk about that resiliency, and I know you were at one point wearing a different hat in working in the community, and specifically in the African American community as well. What was the perspective on resiliency that you experienced personally as you were working to help the community at various levels?
So in my role previously with the Long Beach Health Department, I oversaw our youth health education programs, and I also oversaw our public health emergency management programs. And so with those public health, a lot of the work that we see in public health or that we do in public health, we don't see. Those are invisible. The benefits are sometimes invisible because we are preventing diseases, we are preventing health outcomes. And so a lot of the work that I've done previously has been with prevention. And so with public health emergency management and the work that I do now, we want communities to be prepared African Americans are disproportionately impacted by disasters. And so recovery, it's one thing to get through the disaster, which might be a day, which might be a week, but communities see those impacts for many months to years after the disaster has passed. And so helping communities to be resilient, to be able to recover as quickly as possible from those disasters is vital to making communities thrive and for them to be healthy. So there is definitely a connection between public health. When people are impacted by disasters, they are out of their routines. If we're looking at individuals who are elderly or who are disabled or who need medications, a disaster is going to make it more difficult for them to live healthy lives. And so whatever we can do as individuals, but also as neighborhoods and as larger communities, we need to work together to come up with solutions and strategies that will keep our families healthy as we get through the recovery phase of any disaster.
And I had a very interesting personal experience with that, Diane, because I was just in New Orleans a couple of weeks ago, and they took me through the lower Ninth Ward. And the lower Ninth Ward is basically now just a big field with streets that still go through it because the homes have not returned. And the homes that did return, which were built by some famous Hollywood actors, are now peeling apart because of the shabby construction with which they were built. And so that's an example, profoundly speaking, of a community that didn't bounce back from a disaster. Dr. Davis, I know in Long Beach, I once heard a presentation that talked about the differences in life expectancy from one zip code to another. Very profound. Can you share that information and your perspective there, please?
I sure can. So there's between a 7 to a 15-year difference in life expectancy in Long Beach among different neighborhoods. So depending on where you live in Long Beach can determine how long and how well you're expected to live. And really the contributing factors are the things that we've been talking about throughout this day. So it's unequal education, unequal jobs, unequal access to jobs, unequal housing opportunities, public safety issues are all contributing factors to why there's such a great disparity within the city. And it's really a public health major concern that we're fighting at the health department.
Ms. Caldwell, I know you're somewhat new, relatively speaking, to our community, but you are in charge of one of the major hospitals here. And I know that you and your team see the faces of this community in a very distressful way each day, and you work hard to alleviate those concerns and bring them back to a healthy status in life, whether it be in that emergency room or bringing new birth to the community. But what are the stories that you're seeing personally and through the eyes and ears of your team there at St. Mary's, especially as it relates to the African American community?
Yes, Derek, and thank you. It's really difficult to talk about health care or public health without talking about social determinants of health. And what are social determinants of health? It's your social determinants of health determines your health outcomes. It's where we live, it's where we work, it's where we play. And unfortunately, in a lot of the African American communities, access to health care, living in unsafe communities, those are all things that impact their health care. Mental health is another big challenge that we face. And so in hospitals, I always like to say, we typically will receive all of the community's ills or all of the issues that are happening in different communities. And so what we try to do through a lot of our outreach efforts, we have our mobile unit, we have our clinics, we have individuals that go out, we do free vaccinations. So we really try to meet people where they are. I've been doing this for a very long time, and I've always been a community advocate, wherever I've lived and worked. But the one thing that I found that's so important is that still till this day in the African American community, there's not a lot of trust of the healthcare system. And that's really sad. And so that is why we take it upon ourselves to go out into the community. And it's also important why we need to make sure as leaders in our healthcare institutions that we have leadership teams, we have boards, physicians, and employees that are diverse. Because when people come into the system, they feel a lot more comfortable when they see people that look like them.
Thank you. And that, I believe, also goes back to some of the earlier conversations about just the norms that are established at home in terms of trust or not having trust. Jennifer, I know that the children's clinic, with what you do, takes the healthcare system to the community, and that you're in schools and you're in various locations around the community. But as we continue this conversation, give some more insight into your strategies and how you deliver your services, but also what you're seeing through the children's clinic in terms of the status of health in our community as well.
What we're seeing is a lot of concern about being able to pay rent, being able to buy food, running out of food before the end of the month. So we really can't talk to patients about a healthy diet if they're concerned about where they're going to live. Right. So we have a trauma-informed approach that is a healing approach, and we really try to work with patients and partner with them. It's a partnership. And if we can't help with rent, but we can help sign families up for food stamps. We have food pantries at our clinics. We can help them with the discount programs, with the phone, to have a phone or utilities or things like that. So we really try to help them in the other things. We have several community classes where we don't even talk about health. We just say, come and cook. We're going to all learn how to make something today. Or we're going to sew something together. So it's just to get folks out of the house so they're not socially isolated and to begin to feel a sense of community little by little.
Diane, I want to go back to emergency preparedness, because as we are recording this, it's raining outside, right? And the rain outside may be minute in my hometown of Mobile, Alabama, but for here, it could be a disaster in terms of people who aren't prepared. So for those who are watching and may underestimate what it means to be prepared, what would be some of those things that you would say to this audience that you may think you have it, but if you don't have 5 gallons of water, for instance, or a gallon of water for each day, that you may be out of touch, you're in trouble, or if you live in a high rise, et cetera. Give us some insight on that. Sure.
Well, in the West Coast, California, we are definitely not as prepared as our friends and family in the Midwest and on the East Coast, because they deal with these weather issues every day. In Long Beach, I think we have, 250, 300 sunny days a year. And so it's hard for us to think about a major disaster happening with our reality. But anything can happen. I mean, thousands of people just went through a disaster. It wasn't a national disaster, but 35 days of a government being shut down for those individuals, that's a disaster that can change their lives. And so thinking about those things that we would need to survive on our own for days and days is what we really mean by preparedness. So realistically, there is a finite number of public safety staff to go around in the city. And so we encourage residents to be prepared for, we say 3 to 5 days, but even 7 days is probably a good amount of days to be ready. And so things like drinking water are very important. So it's a gallon of water per person per day that you want to be prepared, that's in your household. And then another gallon per day for pets that you have, because you need water for drinking, for cooking if you're able to, and for bathing, cleaning. To have canned food and a means to can openers, mechanical can openers, extra clothing, good shoes that you can walk around in if you need to leave, and just personal care items, comfort items, especially if you have children or individuals that have specific needs. We want to make people be as comfortable as possible. Disasters are stressful situations, and so anything that can reduce that stress as much as possible is important, along with having a means of communications and getting information from the outside world. And that might be the neighbor who seems to know everything that's going on in the world. That's a good means of communication, especially if other systems are down. So there's a lot of ways that we can be prepared. We really want to think about, again, our communities who have fewer resources, individuals who have disabilities, our neighbors who are elderly or who don't have transportation. Being sure we check on those individuals is vastly important during an emergency. But sort of like Jennifer mentioned, preparedness is not always a priority. If I have to feed my children and that's difficult for me, then it's going to be really difficult for me to have food just waiting there ready for an emergency. If my doctor only prescribes a set amount of medications for me, but I want to have medications stocked away for an emergency, it's going to be a challenge to get those extra medications. And so we are looking to work with the community to find strategies that work for the various needs that we have. And again, that's why I keep going back to communities and neighborhoods, because we're going to need to depend upon each other during a major disaster.
And we shouldn't underestimate that if we educate our youth, they really take it seriously. I just had my granddaughters at a presentation by a gentleman from the fire department, and they made sure they got those little green bags, and they came over to my place to spend the night and put their shoes in the bag and put them under the desk, under the bed, because his point was, if there's an earthquake or something and the lights go out, the first thing you get up is you jump up and you run out to see what's going on, but you're stepping on things in the dark, which could be glass or other things to cut your feet. So stick an old pair of shoes in a bag near your bed so that you can walk around in the dark. Because I guess that's where many of the injuries happen after the disaster,
right,
not during the disaster.
In earthquakes, people get hurt not because of something falling on them, but because they're trying to get to someplace in their home or at their business or outside, and they fall. So shoes are very important.
And the point being that just not underestimate the power of the youth in our homes to take this seriously and be a part of the team and not just doing what we say necessarily. You were about to make a comment, I believe, on that as well.
Yes, I was just going to add to the discussion about social determinants of health and competing priorities. One of the things that is particularly affecting Long Beach is sexually transmitted diseases and HIV. And unfortunately, African Americans are overburdened with both of those diseases. Gonorrhea, chlamydia, syphilis, and HIV are the major reportable STDs. And Long Beach is number 2 in the state for rates of gonorrhea and chlamydia, and number 3 for syphilis. Wow. And all of those rates are higher in the African American community. And congenital syphilis, which had almost gone away until about 10 years ago, kind of started a resurgence. You know, Long Beach hadn't seen any in several years, so this is when you pass it down to your baby. We've had 8 cases in 2018. It's a completely preventable disease if you get treated. 7 of those 8 cases were among African American women, and it kind of points to the social determinants that Carol was speaking about, because a lot of times most of these women are homeless. There's usually a mental health issue. There's poor access to health care. Sometimes there's other children that she has, and she's worried that if she goes to a doctor that she'll be reported to Child Protective Services, either because of drugs. There's a lot of transactional sex, either for somewhere to live or for money. So I just wanted to bring that up,
Right.
that is something that is really affecting the city of Long Beach. And we're doing all sorts of things out in the community. We're up in North Long Beach and Central Long Beach to address that.
Carolyn, are there any particular trends that you're noticing there at St. Mary's, be it from the African American community or otherwise, in terms of health issues that you're seeing maybe a spike in or consistency with?
Definitely some of the sexually transmitted diseases. And one thing I have noticed, particularly in the African American community, is stigma around certain, diseases or conditions. We have CARE, which is our care program at our facility, and it's been around since the 80s. So we take care of individuals who are impacted or infected with HIV and AIDS. And what we find, and I think Long Beach has a very high prevalence of individuals living in the community, but unfortunately, oftentimes in the African American community, because of that stigma, they may test positive, but then getting them to get into care sometimes is very difficult because, they're ashamed, or my family think, and because we as a society have created this stigma. The same thing with mental health. I just had a friend this week that said, I think I've got some issues here. I'm finally owning up to it. I'm going to get help. And this is someone who's African American male. And he kind of made a plea that, as a community, we really need to stop with some of the stigmas around some of the illnesses that we're impacted by, because it's really killing us. And so that's what we're seeing. And we're just very fortunate that we have CARE, and we have a lot of diversity in our program. And so we have a lot of social workers that are able to, once people test positive, that will go and talk to them privately to try to get them linked to CARE. But there is still, unfortunately, that stigma out there. And unfortunately, because of that, we have a lot of women that are being infected unknowingly because some of the men are afraid to go out and get CARE or even to get tested. So that's what we're seeing. That's pretty troubling still.
I sit here as someone who went through bladder cancer. And I can remember seeing the sign a year before I actually acknowledged that it came back and something wasn't right with my body. And I ask you this, Carolyn, and you too, Dr. Davis, because I think denial might be part of some of the issues that we bring on ourselves. Had, through the grace of God, that I sit here, because the tumors grew inwardly as opposed to outwardly. But what are you seeing in terms of people being in denial of issues such as maybe it's high blood pressure, it could be diabetes, it could be something else that's going on with their bodies? What would you say to whether, especially males, I mean, our egos let us get in the way. I got this. I rationalize, the blood was when this guy hit me the other day when I was playing basketball. That's got to be what it was. But are you seeing that on a grander scale? And if so, what would you say to some of the people who are watching about, listening to their bodies is what I tell myself, whether it's a headache or any other ache, to be sure that we stay ahead of the curve?
So I practiced family medicine for 11 years before I joined the health department. So I was seeing patients. And so the first thing I'd like to say is it's not just the African American community. There's lots of people that have kind of a distrust or a skepticism about Western medicine. And I think that that's okay. I do think that African American community has a little bit more. And I think some of that is well-founded. We all know the history of the syphilis experiments. There's implicit bias that goes on today. So there's definitely, thoughts and images that a person will have about you because you're African American. That's in the medical field, just like it's in every single other field. So I can understand where someone is coming from. I think the important thing is to find a trusted resource. Now, I've had African American patients who didn't trust me either. I do think it's important to try to find someone that you trust, whether it's a friend or faith-based or a colleague or somebody, and to try to stay as open as you can. It's very difficult.
Right.
It's very scary,
Right.
you know. But I think if you can find somebody who, you know, when they're trying to tell you, hey, you know, you need to go in, this doesn't seem right, you know, and really challenge your beliefs, like we're asking the physician or whoever's on the other side to challenge their beliefs as well. Sometimes we need to say, you know, try to take a step back and say, what's the best for my body, and are they really trying to do something, you know, harmful?
And that's hard, Carolyn, because the first surgeon after 3, he gave up on me and said that I should just have some dramatic things done. And I go to an oncologist and he's like, you need a better surgeon. So that didn't help in my trust. And people who don't have a lot of money or a lot of resources, they are at a greater disadvantage to try to help navigate their way through that. Do you find that to be a concern at all?
Absolutely. And I always tell people, you know, don't be afraid to get a second opinion, because I do agree. I think there are biases sometimes. I think, you know, and we're not immune to it as healthcare providers. I mean, people have, you know, stereotypes of what they think is really wrong with people. And so we don't listen always as healthcare professionals. And I have a lot of people that will call me and ask questions, and I give them honest opinions. And sometimes I will say, you need to get another opinion. I'll just tell a quick story, and I think I may have shared this one with Derek, not at my facility now, but at a previous facility. There was a very well-known television personality, down on her luck, ended up in the desert, staying at a friend's house, and she was having some health issues, came to, unfortunately, I'm ashamed to say, my emergency room, and they treated her. She got back on her feet, but then when she tried to get health care, because the physician had written in her chart, patient has delusions of grandeur, because she had told them that she had been this television personality. But when I talked to that physician, which was a very nice physician, and he said, but Carolyn, the way she looked, he said, I just assumed that she was homeless. So they didn't believe her. So we got her chart amended, but there it just goes to show that, you know, this poor lady, you know, she wasn't homeless. She was down on her luck. She was having a hard time, and she was having anxiety attacks, and so she comes in. But because they didn't believe her, they discounted her and made this statement in her chart that harmed her later that we were able to correct. And when I pulled up on my iPad and showed the physician who she really was, he was embarrassed. He says, that's not what she looked like. I said, but here's the point. It doesn't matter. I said, when people come through our doors to receive care, it doesn't matter what they look like. They should all be listened to, heard, and treated with respect and dignity.
And that goes back to your point earlier about we need to have people in these positions that look like us, think like us, understand from a cultural perspective, whether the us is African American or Cambodian or any other ethnicity, that we all bring our culture into those institutions when we walk in the door. Jennifer, I haven't forgotten about you. It's such a rich conversation. But I know that you've been very involved, and I know that the Children's Clinic is actually in school sites. And I would imagine that dynamic of actually being in the school is offering you quite a bit of insight that you wouldn't ordinarily get even before you get to the hospital. You're seeing it at the Genesis often, right?
Right. It is beneficial to be at the school sites. We're in a middle school and a few elementary schools. Mm-hmm. And it's nice that we can build rapport and a relationship with families, and that they begin to feel comfortable with disclosing anything they need to disclose. And if they're not ready to disclose, that's fine. Our message is, we are here when you need us. We'll always be here, and we'll do whatever we can. But it's important that people feel comfortable and not feel that maybe they're being judged or anything like that. So yeah, the school site really helps us do that.
Now, I know that I recently had the opportunity to meet with you and Dr. Nicholas about a particular collaboration. Not that I'm asking you to speak about that necessarily, but collaborations are important to you in being successful. And I want to talk about the word collaboration with all of you, because I know it takes a village, as they would say. But what are you finding in terms of collaborations as it being important to you achieving the mission of the Children's Clinic?
It just makes everything easier, because when we come together, our ideas and our approaches are so much more successful. Mm-hmm. They're more insightful. They have a deeper meaning. For me, it just makes my job much more easier when we come together in partnership and we involve community from the start to the during and the end and everything, and that the community members have a meaningful participation in decision making throughout the process. So for me, that's important.
Right. Diane, what would you say? I know from when you're talking disaster recovery, you got to meet people where they are to get them where you want them to be. So I would imagine collaborations with nonprofits like Long Beach Community Action Partnership and others might be important. But what are you doing in terms of collaboration with the community to get the word out about what you think is important?
Sure. For us, collaboration is really important because we are, like a lot of agencies, we're very limited in staff. And we definitely want to meet people where they are. So we are finding leaders in the community that we can partner with. And so most recently, we've been doing a lot of work with North Long Beach and the neighborhood associations and council members in Richardson to educate their neighborhood association leaders, and so that they can hear about the resources that the city has and learn about what people need to do to prepare, and then work closely with their neighborhoods to help build their capacity to respond to a disaster. And they're doing that in their own way. They know what specific needs that they have. They know where the resources are in their communities. So we're looking to build that a little bit more in the next coming year. There's a program that we're initiating called the Map Your Neighborhood program. And so it's finding those community leaders or those streets who are ready, want to work together. And so they come together and they meet and they map out their resources. And so there might be a teacher that is retired, who, if there's a disaster, the children can go to that person's house and get some instruction while we're waiting for the the school systems to get back online. There might be somebody who is a plumber who can help people with their plumbing lines during a disaster. So identifying those community resources is the major component of the Map Your Neighborhood program, and writing it all down, and so that it's available and you can easily find people that you know that you've already met and that you've built relationships with, so that in an emergency, that's one less step that you have to go through. You can figure out what you where the resources are, what you can do quickly and easily.
Well, it sounds like an excellent program, and I'd love for us to be able to continue to help you promote that.
Definitely.
I think we'd be remiss if we didn't address something that's a major issue, not just in Long Beach, but all over, and that's homelessness. And I know Dr. Jane Conley from Cal State Long Beach was on a panel earlier, and I know that there are even, in some cases, homeless students at the university level trying to get their education. And Dr. Davis before said it's hard to dream when you're worried about taking care of today. So I know the homeless count was done recently, not that I'm asking you for numbers, but from your perspective, and I know it impacts Carolyn tremendously at St. Mary's, what are your thoughts on the state of homelessness now and where we're headed in terms of addressing that in Long Beach?
Well, I think nationally it's a public health emergency. I think that it is nationally.
Wow.
Of course, it's hitting some places harder than others, but I think nationally it's a huge issue, and I think it affects so many other things. that it's kind of one of those foundational areas that we all need to work on. It's kind of it's a human right, and it's something that, is very difficult to expect somebody to eat healthy and exercise and go to school. I mean, it just affects so many different things that I think it's really one of the number one things that we need to be working on. We did just finish an Everyone Home task force report with the mayor, the health department did, and several community members and community organizations. That's one area where we do a lot of collaboration. And so there's a lot of ideas that came from that, recommendations. It's just finding the funding and the staffing to really drive those points home, which I think is the issue for everyone. But I think it's like when you're looking at something like STDs, when you're looking at, acute medical care, when you're looking at disaster preparedness, when you're looking at basic primary care, if the housing situation isn't stable,
right,
you're swimming upstream.
Right. Carolyn, how are you seeing this impact you at St. Mary's?
Well, it's definitely a challenge. We recently received some data a couple of weeks ago, and of all of the Dignity hospitals in California, our facility, we're seeing the fourth largest number of homeless individuals that come to our emergency room. And with Senate Bill 152, which is a California state law now, there are guidelines as far as how hospitals deal with the homeless population. We have to make sure that we provide resources. We have to provide a meal. If they don't have proper clothing, we have to provide clothing. We have to provide transportation when they leave the hospital. And we have to make sure that we provide some type of mechanism for them to receive care. The one thing about the homeless population that a lot of people may not know is that a lot of them have insurance. And so that's where TCC has been a huge resource to us, because we're able to get some of these individuals into care. And then there are resources within Long Beach, while we don't have enough, that do help us with the homeless populations. And I know the task force that we worked on, there are other initiatives that are in the works as far as providing additional housing for the homeless population. But it is a concern. Yeah. And it's not just adults, but it's children, adults with children.
Right.
And that's where it becomes more challenging. I mean, they live in hotels or various situations. And we, as a facility, try to do whatever we can, but we do it in partnership. We also partner with the police department and also the fire department as well.
And Jennifer, mentioning children, I know that I have a granddaughter that came home from school, and her mom was wondering why was she paying for lunch when she was giving her lunch every day. And it was because someone was taking her lunch, and it turns out that child was transitioning homeless and didn't have anything to eat. I would imagine with you being right on the school campuses, you're seeing nutrition being a major issue, along with the impact of homelessness. From a child's perspective, it's much more traumatic, I would imagine, as well.
Right. We have seen that. I would say, too, that we've seen the impact of the fast food restaurants and things in the neighborhood. And so although it's kind of interesting that some families really rely on those fast food restaurants because they're less expensive, but then they're not really getting the nutrition that they need from them. Mm-hmm. And so may have patients that are overweight or obese, but they don't have enough food or healthy food.
Right.
And so it is a struggle, really a daily struggle to really find ways to have healthier options for families in the neighborhood and healthy places to exercise and things like that. It is really a struggle, even just with the number of green spaces from one area to another. Even the types of fast foods. There's certain types of fast foods in wealthier areas than there are in lower income areas.
Right.
Yeah, so it's unfortunate. We just have a lot of work to do.
And I would imagine, Diane, that community mapping that you're talking about, that's a good point. When you say fast food, there's some that flame broiled or whatever you want to say that theoretically is healthier than what's deep fried. But Diane, would some of these elements come into that community mapping that you're talking about? That if you've got to eat fast food, here is the lesser of the evils, so to speak?
Sure. I mean, those would be resources that
Right.
Could be mapped. So definitely.
Right. Dr. Davis, on a grand scale, what are you noticing as some of the trends that alarm you, other than what we've talked about already? Is there anything that just stands out in your mind that, as a community, and specifically since we're focusing in the African American community, are there particular trends that you think we could really get our arms around it if, as a community, we were better informed and rallied to really do something about it? I know there's a long list.
Yeah, I mean, one of the things, I wanted to become a doctor because of health care disparities in the African American community, and that's when I was 12 years old. And I'm 49 now, and I feel like it's many of the same conversations. It's very depressing to have to say that, but it's true. What I'd also like to say, however, is that we have such resiliency and strength. I really do believe that. I believe our panelists, yourself, you guys in the audience, is so inspiring. I think it's very easy for us to say we want to solve this all in one generation. I want my kids to be the next president of the United States and what have you. And what I had to come to grips with is, you know what? I hope their lives are better than mine were. I hope that they have less roadblocks and obstacles. And so I feel like that's what we're all kind of striving for. It's just to try to make this next generation a little bit better. We're not going to solve all of it because there's, but I think, we've already come so far when I just see all of us together.
They're giving me the signal that we have about 3 minutes. So we're on an elevator, and we've got an opportunity for your elevator pitch real quickly then. Dr. Davis, I'm going to keep it with you. What is the thought that you want to leave me with before I get off the elevator with you about public health?
I would like to leave you with the thought that the Long Beach Department of Public Health, the Long Beach Department of Health and Human Services, really is about collaboration. Public health, to me, is almost anything that affects the health of the community. So it's community violence, it's education, it's housing, it's HIV and STDs, it's, jobs, it's anything. So what I would like to leave you with is seeing us as a resource, as a collaborator. We don't have all those pieces, but we have the passion and we have the ability to kind of bring people together. And so I would just hope that you would reach out to us to really facilitate and just be a player in making Long Beach the best place possible.
Thank you. Carolyn.
What I would like to say is, while we still have challenges that we need to address, I've lived in other communities, and I will say that the Long Beach community is one where I have seen the most collaboration that I've ever seen between our hospitals, our health departments, our FQHCs, and our local fire, police, going to a meeting and listening to our fire and police departments talk about our homeless population as they are people, seeing them as people, that they're just not, a person. And that's something that I feel really good about. We have a lot of work to do, but I think we have the people here to get it done. And the collaboration and people that are really sincere about addressing some of the challenges and concerns that we're seeing in the African American community.
Thank you.
I was thinking about this. And I think what I would like to see personally is a more united, African Americans more united. I feel like we're a little bit divided. And when I walk down the street and I meet eye to eye with another African American, I would like them not to look away, and I'd like them to say hi, and I'd like to say hi to them too. I just would like the highest level of health for everybody. That's all right.
Thank you. And Diane?
I just want to say that preparedness doesn't have to be hard. It doesn't have to be expensive. You don't have to purchase a kit for your home, your car, and for your workplace. You can assemble it yourself over time, and that way you can tailor it for your family's needs. And then I just want to really encourage everyone to sign up for Alert Long Beach. That is the city's mass notification program. So if there's any kind of disaster emergency, you can get information from the city that will go to your phone, your email, whatever information you provide. You just want to be as informed as possible during an emergency, and that's just one of many ways that the city and the community will get in touch with you.
Thank you, ladies, for a very engaging conversation, informative conversation, and for your leadership. Thank you guys in the audience. What do we say? We give these ladies a round of applause for their assistance. We have to keep the dialogue going, and we will collaborate. And thank you all for joining us to talk about the African American community at a crossroads.